Good evening. My name is Herman Wakiwaka. I'm an Indiana State University student. I'm taking nursing 444 community health education. Today we're going to talk about hypertension, education, and prevention in the community. For learning objective, at the end of this education, participants will be able to define hypertension. Participants will be able to know how to measure blood pressure. Participants will be able to distinguish the different type of hypertension. Participants will be able to know the cause of hypertension. Participants will be able to know population at risk and risk factor of hypertension. Participants will be able to know how to prevent hypertension. Participants will be able to know how to manage hypertension. Prior for us to start the presentation, please it's important to please take a pretest to access your knowledge by following this link below regarding the hypertension prevention and the cause of hypertension. What is hypertension? Hypertension is the elevation of blood pressure of a normal range or high blood pressure. It is one of the most modifiable factors that can lead to the development of cardiovascular diseases and other diseases that will be given later in during this education. Current guidelines reveal that around 46% of adults in the United States meet criteria for the general diagnosis of hypertension. Heart diseases, often directly related to hypertension, account for 23.7% of all deaths each year in the US. Data from the National Health and Nutrition Examination Survey show that 83% of people 20 years of age and older with hypertension were aware that they had high blood were aware that they had high blood pressure. 76% were receiving treatment and 48% did not currently have their blood pressure well controlled. Blood pressure management. Blood pressure is the force exerted by the blood against the wall of the blood vessel. It must be adequate to maintain normal blood pressure for tissue perfusion during activity and rest. It is composed of two numbers represented as a ratio. We have on the top the systolic blood pressure and on the bottom the diastolic blood pressure. And the systolic blood pressure, which is on the top number, is defined as the peak of the pressure exerted against the artery when the heart contracts. Diastolic blood pressure, the bottom number, which is the residual pressure in the artery system when the heart is filling with blood or at rest. To measure the blood pressure, we can use the invasive and the non-invasive technique. We will focus on the non-invasive measurement, which can be done with stethoscope and sphygmomanometer. It is easy to find some more automatic wrist or arm blood pressure measure curve, which is easy and to use. For better accuracy, it is important to use a proper size of the sphygmomanometer curve based on the patient arm circumference. For instance, using a baby-sized blood pressure curve on an adult will give a high blood pressure reading or a normal blood pressure reading. And different non-invasive blood pressure measurement curve. In the first picture here, we have the automatic blood pressure measurement apparat. Here you can see like the person will have a blood pressure cuff on his arm. For to do that, you just have to put the cuff on your arm. You rest your arm on the surface and press the start button. And from there, the app is going to pump and it's going to give you a reading later on. If you are using the wrist blood pressure, make sure that your wrist is above your heart. And when you look at the first picture, you can see the first number represents the systolic blood pressure. The second number is the diastolic blood pressure, and then the one below that is represent the pulse. On the second image, you can have the manual blood pressure curve. You have like, as you can directly, you have the sphygmomanometer, you have the curve, the artery, and then you have the stethoscope that the person taking the blood pressure used to hear the heart sound. On this slide, we're going to focus on the classification of hypertension. Normal blood pressure is defined with systolic blood pressure, with systolic blood pressure less than 120 mmHg mercury, and a diastolic blood pressure less than 80 mmHg mercury. Elevated hypertension is when the systolic blood pressure is between 120 to 129, and the diastolic blood pressure is less than 80. Hypertension stage 1. Systolic blood pressure is between 130 and 139, and the diastolic blood pressure is between 80 and 89. And then you're going to have hypertension stage 2, which is defined as the blood pressure is higher than 140, and the diastolic blood pressure is higher or equal to 90 mmHg mercury. If either the systolic blood pressure or the diastolic blood pressure is out of range, the higher measurement determines the classification. For example, 115/86 would classify as hypertension stage 1 due to the elevated diastolic blood pressure. Cause or etiology of hypertension. Primary hypertension, essential or idiopathic. It is elevated blood pressure without an identified cause. It accounts for 90 to 95% of all cases of hypertension. The exact cause for primary hypertension is unknown. There's a multiple contributing factors such as increased sensory nervous system activity, overproduction of sodium retaining hormone, increased sodium intake, greater than ideal body weight, age, gender, family history, ethnicity, diabetes, tobacco use, and excess alcohol intake. Secondary hypertension is an elevated of blood pressure with specific cause that can be identified as uncorrected. This type of hypertension accounts for 5% to 10% of hypertension in adults. Secondary hypertension can be resistant if it is untreated, causing cardiovascular complications. Common causes of secondary hypertension have cirrhosis, congenital narrowing of the aorta, drug-related, such as estrogen therapy, oral contraceptive, pregnancy-induced hypertension, brain tumor, renal diseases, and sleep apnea. Population at risk of hypertension. People born outside of the United States, living in the household not speaking English, or living in a household with limited time living in the US are at risk of hypertension. Black or African American have the highest prevalence of hypertension in the world. Likely to have resistant hypertension, develop hypertension at younger age than other ethnicities with higher average blood pressure. have the higher death rate from hypertension. Hispanic have the lower rate of blood pressure control than white and black, and lower level of awareness of hypertension and its treatment than Caucasian and African American. Before early middle age, hypertension is more common in men than women. Women who take oral contraceptives are 3 times at risk of hypertension than women who do not. After age 64, hypertension is more common in women than men due to menopause causing shifting of hormones such as estrogen and weight gain. Complication of hypertension. Hypertension can lead in the targets of organs in the body such as the heart, the kidney, the brain, eye, and peripheral vessel. Coronary artery disease is caused mainly by hypertension. Cerebral arteriosclerosis and stroke are mainly caused by hypertension. Chronic kidney disease's main cause is hypertension. Retinal damage. The appearance of the retina gives essential information about the severity of the hypertension. Blurry vision, vision loss can be one of the consequences. Hypertension management and prevention. It's important to have regular moderate physical activity. We have tobacco cessation, moderation of alcohol intake, stress management technique to reduce stress because stress is one of the high cause of hypertension. We have restriction of sodium and salt intake, restriction of cholesterol and saturated fat. You have to maintain adequate intake of potassium and calcium. We have a weight management. We have a blood pressure monitoring at home and antihypertensive drug therapy as prescribed by the physician can be very helpful to manage hypertension. For more information regarding visit this website, the CDC government website, blood pressure and prevention management, and then the NCBI government article which kind of help to know how teach you how to manage hypertension and prevention. Please go to this website and do the post test education by follow the link below, and as well after you're done doing the post education test you can come and check the answer here. Here we can see my references that I use for to do this hypertension prevention education. Thank you.